Hello everyone, welcome back once again. There is a there is a small topic which requires your attention with regard to medical technology laws. We have a full-fledged master program at our university related to medical laws. But when it comes to the technological innovations in the arena of medicine, there are numerous new technologies have emerged in the past decade, and these numerous new technologies have posed numerous questions for legal system and for legal scholars. These questions ranges from very very minute issues such as the licensing contract usage to very complex questions, for example, liability, and so on. So I just wanted to give you an overview of medical technology laws, that what sort of medical technologies are laws are there and how they are posing challenges to our legal system. These are two websites. I will share these slides with you, and you can see that United Kingdom, they have done enormous in the field of medical laws. Even in the era of COVID-19, when the COVID-19 came, I think they were the first one to enact special laws related to COVID-19 pandemic. When the countries were just thinking what to do with this regulatory issues related to COVID-19, United Kingdom had already enacted a law related to COVID-19. You will go on this website and you will see that historically they have been very, interactive with medical sciences and been developing so many laws related to the medicine. For example, there are specific laws related to ophthalmology. I mean, the study of diseases of eyes. So they have very specialized, sophisticated and detailed laws related to different areas of medical sciences. Yes. So the first question, the matter of concern is the liability. So many autonomous robots are being employed by many hospitals. You can go on internet and you can find surgeons sitting in one part of the world and doing operations in the other part of the world by using these autonomous robots. So definitely the question of liability comes up, that who will be liable if operation goes wrong. There are laws, people are calling for new laws. The doctors and the hospitals themselves are becoming more and more conscious related to making new laws related to the liabilities issues. And when it comes to the pragmatic importance of these laws, it is undeniable that these robots will definitely pose a question related to the liability. And that's why we need new laws related to it. The other area in medicine, which is called as nanomedicine. Nanomedicine is the medical application of nanotechnology. Nanomedicine ranges from the medical application of nanomaterials and biological devices to nanoelectronics, biosensors, and even possible future applications of molecular nanotechnology, such as biological machines. This area is revolutionizing medical sciences. New and new innovations are happening and new legal challenges are emerging. For example, you might have heard when this COVID-19 came and the vaccine was invented, and the people and the government started a free vaccine campaign, and many people were calling for some sort of control. Many people were saying that they want to install microchips into our body so that they can monitor our activities. And we all have heard these sort of superstitions that by using these sort of microchips, they want to monitor our activities. I don't know why we think that we are doing very sophisticated intellectual work in which someone might be interested. So this question of installing microchips is not new. People have been talking about, for example, I read somewhere that some people have reservations related to the shampoos for cleaning hair. So they were saying that we shouldn't use this shampoo because this shampoo can impact on the man's health in a specific way. Similarly, when it comes to the salt, we use salt with iodine. Iodine is a mineral which is required by the body. many people had reservations uh, with regard to this iodine, which is mixed with the salt, that this iodine and salt are dangerous for our health, and there is a specific agenda of some countries to feed us with this salt so that we become impotent and lose our ability to born children. So these sort of superstitions were always there, but nanotechnology is revolutionizing the medical field, because it is not a superstition, it is something physical which can be seen, which can be touched, and the real impact can be felt. So there is a need to make laws related to them. This is a very interesting phenomenon, medical cannabis. We have seen that many countries have legalized many people have realized that this can be used for recreational activities. And the recreational activities are the use of medicine, some sort of narcotics. So many countries have actually, introduced these laws to facilitate or to somehow tolerate the use of some of the narcotics. Some of the European countries have made laws related to this, and medical cannabis is now being used for very medicational purposes. And to some extent, some very progressive, legally progressive countries have started tolerating to the cannabis, and laws are there. And this is a very good example when there is a need to make a new law, when a product which has a medical purpose cannot be utilized without getting a medical service. So there is a process in which you need a medical product, but you cannot use this medical product without the supervision of a medical professional. For example, abortion pills. So in many countries, there are laws related to abortion pills, that you can take an abortion pill, which is legal, but you have to take it under the supervision of a medical professional. Okay, so there is a new product which is a hybrid of product and service. Yes, so this spectrum shows that how this spectrum is becoming broader. And a good example of this abortion pill, that you can take the pill, but you need the services of a medical professionalist, and only under his supervision you can take this pill. Yes, this is the area, revolutionary area, which is called as biotechnology. People are working in this area and trying to regulate the use of biotechnology. Biotechnology means anything. I would define it that anything in nature you can imagine, and it is possible. So regulation of biotechnology is typically slow to the respond, because the innovation in the applied area is much faster as compared to the legal area. The only area of concern is the ethical question. Yes, and when it comes to the ethical question, usually we bypass them. We don't care about the ethical questions. Yes, and when it comes to the innovation, usually the science comes first, which means that legal scholars are not consulted with. Scientists, they don't care about the legal scientists, they care only about the applied science part, and they only care about the making new and new medicines or drugs or procedures. And when it comes to the registration or patent, or to get intellectual property rights, only then they consult with the lawyers. Yes, so in short, you can say that the technological progression is very fast in terms of biotechnology or all other medical technologies, but the legal progression is comparatively slow. And good example is this embryo screening. Embryo screening means you can scan the embryo and you can see what is inside it. So just imagine a world where most baby are born through in vitro fertilization, means you can take the egg outside of the body, you can take the sperm, you can make an egg, and then you install this egg back to the body of the mother. So imagine a world where most babies are born through in vitro fertilization. Doctors are given a report that outlines the risk associated with each embryo. So you can see that embryo is healthy, embryo is damaged, embryo is with some sort of issues or whatever, and then you can install it back to the body of the female. Yes. So embryo screening, it advises you to pick an egg of your choice. And the benefits of this is that you can use embryo screening and in vitro fertilization for selecting a healthy egg, which will potentially form into a healthy baby. And this will help the baby to survive many deadly diseases, because many diseases are genetic in nature, and these diseases require specific treatment. At later stages it can become a huge problem for both the baby and the parents. So it is better to rule out this issue of genetic diseases being developed in the future at a very early stage when the egg is formed. And if the egg is not as per your desire, you can just simply use another egg. Many diseases, for example, are Alzheimer's, Huntington, cancers, diabetes. These are genetic diseases. You can know about these diseases at embryonic stage. Okay, and this is already being done in US. Down syndrome. So what does it mean by Down syndrome? You might have seen babies with the short height, big faces, flat eyes, their tongue a little bit is outside. Their appearance is same all over the world. Yes, so they are Down syndrome babies. In USA, screening is being done related to Down syndrome babies. Hello, hello, yes, no, okay, yes, yes, I can hear you. Is there any question?
Dear students, if you have bad connection, you can write your questions in chat, I think.
Or you can ask
Yeah.
at later stage. Yes, I will share this video and then you can ask. I am about to conclude soon. Yes. Okay. So, for example, Down syndrome, legally it is being monitored, and for this disease. And in Pakistan we have a law which is actually similar, analogous to this law in USA, for sickle cell anemia. The sickle cell anemia is when the red blood cells in your body, they make the form of a sickle. This is a type of cancer, and these babies, they require transfusion of blood on regular intervals. So in Pakistan, now by law, it is required that the parents should have some sort of medical examination before getting married, so that the people should have babies which are healthy and not with sickle cell anemia, because it can cause a huge damage, not to the baby, but to the society. The social cost is very high of this disease. To this extent, it is very good that you care about the social cost, or I don't know if the social cost is a proper word to use here, but for many parents it is a choice to choose a healthy baby. And the question is that should you be able to choose a baby's genetic health? Majority of the people will say yes, we should be given a choice. If technologically it is possible, why not? Why not should be given a choice to select the baby of our own choice? But it doesn't stop here. It is not only about the diseases or the negative qualities or characteristics of a baby. In future, it will be possible to choose the color of the hair, the color of the eyes, the length or height, IQ, yes, the voice, intelligence, anything you can imagine can be choose. It will be optional for the parents. If you want to choose the skin of the color at the embryonic stage, you will be given a chance. So in case of diseases, it is okay. All of us are agreed that if there is possibility, technologically it is possible to do the screening, why not? To save the child itself, society, and the parents from a huge psychological burden. But what if we are given a chance to select the positive characteristics? Then it becomes a slippery slope, that where you will put an end to this, because there is no end. People are greedy in nature, you can say, and they will demand more and more for themselves. And if we do the commercialization of this thing, you can just imagine that how the things will go wrong and even worse. So benefits are longer and healthier life if you are given a chance, and the cost is loss of genetic diversity, which means that all the babies will be white, tall, blonde, with blue eyes and intelligent. And I mean, our standardizations of beauty and health are universal. Everywhere the white people are appreciated, I think. It is my personal observation. So what if the children's are designed because the parents were given a chance? There is a question that diversity will finish, yes, and the mankind definitely does not want to finish the diversity, because diversity itself is the beauty of the mankind. And the question related to the valuable will be changed over the time. When all the children will be white, tall, with blue eyed and blonde and intelligent, then you need further diversity, then you need again the very variations, yes. And the question of valuable, who is the valuable, because now everyone is similar. So the definition of valuable will change. Standard preferences, will change with the passage of time, when the human population will become homogeneous, theoretically speaking, yes. How we will value ourselves? What if baby who was screened to be a music prodigy turns out not to be? So risks are there. For example, you designed a baby for you at an embryonic stage, that this will become a karate champion, or this will become a music prodigy, or this will become a very good mathematician, but things went wrong. Because beside the genetics, there are so many other factors which influence. Maybe during the upbringing of this child, you tackled with different issues. The training was not as per desired of this music prodigy. You didn't train him well and the things went wrong, then what you will do? Okay, so embryonically you can find favorable situations, but what at later stages the parents are unable to provide them with conditions in which their baby will become a music prodigy and the things went wrong, who will be responsible? Yes, and this is a question. What does this say about how we currently value disabled people or people with Down syndrome? Should we be questioning these values rather than reinforcing them? Very interesting question is that for parents, even if the baby is suffering with the disease or Down syndrome or color blindness or sickle cell anemia, it is very, very difficult for the people, for the parents to just simply give up. Yes, they don't give up because it is their baby. Yes, and what will be our the question is not only about standard and preferences, but it is the question related to the essence of human morality, that how we will deal with the people with disabilities, yes, and the people who are suffering with different diseases. So there are so many layers of not only moral but subconscious, psychological, cognitive, national, ethnical, social, political layers are there, which we should look into before making decisions related to this. Yes, uh, and then from the legal point of view, what privacy laws or regulations or bans on screening prevent the realization of these benefits? And what if insurance companies started to require this sort of screening? Yes, so if we will have this sort of technology, the business, here is the example is related to insurance business. Now the insurance business, if you have taken an insurance, before giving the insurance they will ask you to fill a performa, and in the performa there is a question: have you ever been hospitalized? Are you suffering with some sort of diseases? Yes. Did you went through an operation in past 5 or 10 years? So they ask these sort of questions to do their risk management, so that you shouldn't be wasting their money on someone who is already about to die. So what if these insurance company will demand this sort of embryonic screening or this sort of genetic screening? Yes, people will be willing to do this or not, but this will be very difficult for the individuals to go through this screening, because many people we have seen all around us, they don't take medicine because they think that if they will start taking medicine they will become more ill, so they simply prefer to ignore their disease. Yes. And many people don't go to the doctor just because they are afraid that a new disease will be discovered. So that's why they don't go to the doctor at all. Just imagine that screening is being done at state level. Now, corona is a good example that by law, you are required to do the corona vaccination. What if tomorrow the government require everyone to do this sort of genetic screening to see that who is healthy and who is not? So there are so many layers of legal question related to intellectual property, personal freedom, privacy, human rights, and so on. Yes. This is an even interesting phenomena which is called as gene editing. So embryo screening was just to see which embryo is healthy, but gene editing means you can actually choose a gene of your choice. As I gave example in earlier slides, you can choose a gene of your choice and put it into your genetic makeup, so that you can have your genetic makeup change or the genetic makeup, new genetic makeup of your child. Is gene editing any different to embryo screening? Yes, it is different, because embryo screening is a full-fledged embryo. You just simply select the healthy embryo. But in genetic engineering, you can do the changes into the embryo. Yes, it will increase the inequality. How? The people who are genetically selected, they will be considered as genetically superior because they are healthy and with less diseases. Companies will like to hire those people who have chances of not getting ill. Yes. And similarly, you can see that in private sector, people are already discriminating against women or pregnant ladies or old age people. Yes. But what if there is a choice to the employer that he can select a person whose genetic makeup is superior to the other employees or the other candidate? Definitely he will select a healthy person, so that he shouldn't be paying extra leaves or he shouldn't be paying extra money for his health costs. Yes, and it will increase the inequality. Imagine a world where everyone has had a genetic test, reduced to a rating of 1 to 10 that describe genetic quality. Society stratifies on this number. How would this impact society? I already mentioned that the discrimination will increase. Is this any different to what we have today? It is not different, but it will be more worse, because it will be empirical data. Today, if someone is discriminating against female or a female employee or a disabled person or a person with a different sexual orientation, it is very difficult for someone to explain it empirically. But when we have a scientific test related to the genetic makeup, definitely it will become a challenging situation for both parties. So thank you very much for your attention.